and welcome everybody to the ADRA Health Technical Learning Lab COVID-19 Respiratory Protection webinar. Good morning, good evening, good day to you all, wherever you are in the world. We're really pleased to welcome everybody to our webinar on respiratory protection. And I would just like to make a few remarks before we start the webinar. The first point is that if you could all please mute your mics so that we can have an uninterrupted presentation. And also just to let you know that this webinar will be recorded, and this recording will be made available to people who have registered for those who aren't able to actually listen during the webinar itself. I'd also like to just invite you to join with me for a short prayer before Yosue introduces our guest speaker for today's webinar. Dear Lord, we just want to ask you to be with us during this webinar. We thank you so much that you are guiding us during this uncertain time that our globe is experiencing. We thank you, Lord, for the expertise and the knowledge that we are able to present to a wider group. We ask you, Lord, to be with each person who is joining this either during the recording time or afterwards, that you will that the knowledge and information shared here will be able to be presented, and that people will be in a better position to respond and to react in the work that they are doing. We ask these things in your loving name. Amen. So for those of you who don't know me, my name is Victoria Frey. I'm the chair of the Health Technical Learning Lab, and I'm going to hand over now to Yosue. Dr. Yosue is a member of our Health Technical Learning Lab, and he is going to introduce our guest speaker today. Thank you, Yosue.
Hello, everyone. It is nice to be back with you all. And here we are again on one more topic to discuss about COVID-19, about the current pandemic, and making efforts to strengthen our capacity, our technical capacity to respond to this pandemic in any possible way. Today, as you have seen the title of our webinar, we are dealing with COVID-19 respiratory protection, which will have a lot to do with surgical masks and respirators. It is a privilege for me to introduce the speaker for today. I would like to introduce to you all Dr. Paul Arthur Jensen, who is currently serving at the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia. His current position is the lead for airborne infection prevention and control and laboratory biosafety at the Division for Global HIV/AIDS and Tuberculosis Center for Global Health at the CDC here in the US. He holds a dual Bachelor in Science degrees and a Doctorate of Philosophy degree on environmental engineering with minors in environmental health and microbiology by the University of Cincinnati. And he has a long career serving at the CDC here in the US, more than 30 years of experience in various positions. In his current position, he has been, as I said, leading the airborne infection prevention and control and laboratory biosafety, both domestically and internationally. In addition to training, technical assistance, and monitoring and evaluation activities, Dr. Jensen supports a number of regional centers for excellence globally. Dr. Jensen serves on several international committees of the World Health Organization, the Stop TB Partnership, and others. He has published numerous scholarly articles on infection control, environmental safety, respiratory protection, and public health. It is my privilege to introduce Mr. Paul Jensen to you all, and I now give the time to him for the presentation. Paul, the time is yours.
Thank you, Yasue and Victoria, and hello to everybody. What I'm going to be doing is talking relatively fast, but you'll also have an opportunity to have a handout of these slides, and that handout will also include some additional background slides. So here's a cartoon or caricature I found on the web, but it says, "Mom, why are humans wearing muzzles? Honey, they're too dumb and stupid to sit and stand." And in a way, there's some reality to that, because when we're talking about infection prevention and control and also respiratory protection, which is part of it, you know, we as humans don't always follow logic or follow guidance. So what I want to do is give you some more guidance on that particular issue. I'll talk a little bit about the basics of COVID-19, talk about the hierarchy of infection prevention and control, give you an introduction to PPE, but the majority of this talk will be on surgical and procedure masks, as well as N95/FFP2 respirators. And again, I'll define those as we go. So there are a bunch of references. If you scan the internet, you see some bad advice, you see some good advice, and you see some sort of ridiculous advice. But the two primary references that I'm using for this talk are WHO and also CDC. So as you probably all know, in February of this year, WHO announced the official name for this disease, COVID-19. And just to make sure everybody understands about this is, you know, the CO obviously is corona, VI is virus, D is disease, and 19 means that they theorized that it jumped to humans in 2019. And I just want to make a distinction between disease and the organism itself. The virus is actually called SARS-CoV or coronavirus 2. It is a new or novel coronavirus, and coronaviruses have been around for a long time, and everybody has heard about SARS, and most have heard about MERS. Those were also or are also coronaviruses. We know that it's spread person to person. We also know that if you're in close contact with somebody, the probability is higher than if you distance between people, which is why we're using the term social distancing of 6 feet or 2 meters. Though the social distancing, you know, has its own negative connotation. But more recently, there's a thought that it is possibly inhaled into the lungs, which means it's spread to some extent, you know, a small fraction, by the airborne route, meaning that small particles could be aerosolized, remain aerosolized for a long time, travel some distance, and then be inhaled and into the deep lung and then infect the person. We know that it's easily spread, and we know that it also appears to spread more efficiently than the seasonal or the quote unquote normal flu, but not quite as efficiently as measles. So let's talk about the hierarchy of infection prevention and control. And this is probably a slightly different graphic than you might be used to, but part of it's the exact same. So let's talk about it. When we talk about the hierarchy, what we try to do is we try to put managerial and administrative controls in first. And that means we've got the policies and practices in place, and that people follow those policies and practices. Next, we'll have environmental controls in place. And lastly, we'll have personal protective equipment. And I'll get into some detail there in a moment. But on this other dimension, what we have to think about is, you know, what do we need to protect the worker? What do we need to protect patients and or prevent patients from infecting others? And then what kinds of things will we do for the entire facility? So you may have certain policies for workers, certain policies for patients, certain policies for the entire facility or portions of the facility. So what I want to do now is just show you a short video. The audio doesn't seem to work, but what I want to do is just show you a video on respiratory hygiene, just so we all get on the same page. And it's called Coughing, Sneezing, and You. And what you see here are really the large particles. You can see the large particles dropping. Oh, don't do that. But what happens? Oh no. Yes, yes, yes. And if you can't reach, use somebody else's knee. And now, if you're in an office, now obviously that's not true. You don't want to do that, but I was just trying to see if anybody's awake at this hour in my time zone. But what we are going to talk about is PPE, and in particular, what should workers use? What should patients use? And we'll also get into the why of the issue. So this is actually a slide from CDC, but it talks about preferred versus acceptable PPE. And if you take a look, everything is the same except the respiratory protection. The preferred is an N95 or higher respirator, and it could be an FFP2. And again, I'll explain what that means. And then the acceptable is a face mask. But we still use the same face shield to protect us from droplets. We use the same isolation gown so that we're not transferring droplets to our clothing. We're wearing gloves. Why? Really for two reasons. One is we don't want to potentially contaminate ourselves, but we also wear gloves, and with proper use of gloves, which means we need the policies, we would either clean the gloves or remove them before we go to the next patient or touch something else to make sure we're not contaminating anything. So what's the difference between a mask and a respirator? In this picture, we have the same person on the left is wearing a surgical mask or procedure mask. The person on the right is wearing an N95 respirator. What's worn in surgery? Surgical or procedure masks. Why? It's really twofold. One is if the surgeon or assistant aerosolizes large droplets, they'll catch on the outside of that mask and not touch mucous membrane, though none of these people are wearing glasses. So from the infection control standpoint, it's marginal. The second reason is that if they cough or expel particles, those particles will be caught on the inside of the respirator. I'm sorry, on the inside of the mask. Here's an architect from Peru. Why is she wearing a mask? Well, she's trying to follow good procedure and not potentially infect others if she is contagious and non-symptomatic or asymptomatic. Here's a patient. Why is the patient wearing a mask? Do all patients need to wear masks? Well, in this case, this is actually a TB hospital, but the idea was that whenever there's a visitor, which is questionable for COVID-19 patients, if ever there's a visitor, then what's happening? If that person coughs or expels particles while they're talking or sneezing or coughing, most of the large particles or all of the large particles be caught on the inside of that mask, and a few of the smaller ones might go around it. Here I am wearing a mask about to go into a grocery store. Again, this is part of the practice of preventing both exposure of others and exposure of yourself. Many of you may have seen a poster like this. Sometimes it'll say for TB, sometimes it'll say for coronavirus, sometimes it'll say for influenza, but basically they're talking about proper cough etiquette and respiratory hygiene. What is not emphasized many times is the personal hygiene, cleaning your hands, washing your hands with soap and water or some kind of alcohol-based cleaner. This slide, I just got off the WHO website, which they need to update a little bit, but it talks about when to use a mask. And what I want to point you to is the very last line that says, if you wear a mask, then you must know how to use it and how to dispose of it. And that's something that's not emphasized very much. This next video's, again, you won't have the audio, but it's actually in Spanish, but I'll try to narrate it. What it is, it's a news clip of somebody interviewing another person about use of masks during flu season. And this is a very appropriate video. This isn't a fun one like the first one. But he's asking this fellow, do you know what this is and why you might use it? And what the person does that I'm really surprised about was he talks about, where it fits. He has one in his briefcase. So he knows that there's a need for a mask. But now watch, what does he do? Do you think he's ever worn it? Obviously not. So there's a training aspect missing. And that's what we have to make sure people understand is even with a simple mask, why do we wear it? How do we wear it? When do we wear it? So we need the policies and practices in place. So now this guy knows how to wear one and why. The first video was really about coughing and sneezing. And more recently, and I say more recently, in the last 10 or 15 years, there's been a push to coughing or sneezing into your elbow or onto your sleeve. Now, next time you have a birthday, or you can even do it now, you can put a candle or just put your hand underneath your elbow and do a fake cough or just blow air into your elbow and see if you feel that air coming around your elbow. So there are really two issues with coughing or sneezing into your elbow. One is it's not as efficient as a surgical mask. And secondly, what have you done? Now, either your skin or your shirt, you now have active virus. And again, it could be influenza, it could be coronavirus, could be something else. And what if you touch that? Then you're going to be transferring that to other surfaces. So again, think carefully when you try to cough into your elbow. And I don't say don't do it. I just want you to think about that. And how about disposal of your surgical mask, your tissue? What we don't want to see, and we just saw this last week in the parking lot of that grocery store. These aren't pictures from that parking lot, but we saw the same thing. We saw gloves laying around. We saw masks laying around. We need to properly dispose of these items. And how do you make a mask? Again, in the handout, you'll see these slides and additional slides on how to actually make a mask. They're different shapes, and what you need to do is find one that's actually comfortable for you, easy to get on and off. You saw something similar to this in the first video, but when you cough, there's some stuff that comes out at relatively high velocity, and then it slows down, slows down, slows down, and by the time you reach, essentially room air currents, you're dealing with just the very small droplets. So when we talk about PPE, and again, I'm just talking about masks and respirators right now, when would we use a mask? We would use masks for large droplets. We want to protect the environment from the wearer. So people, again, it could be patients, healthcare workers, et cetera, and surfaces. So if I'm wearing a mask and I cough, a lot of those particles will be on the inside of that mask. And we also want to protect the wearer from the environment, or protect them from large droplets. Respirators, on the other hand, are used to protect the wearer from micro droplets and droplet nuclei, as well as large droplets. So we want to protect the environment from the wearer if there's no valve. Some respirators have an exhaust valve. So if somebody is wearing a respirator, is infectious, and is coughing, the particles that they cough are actually going to be coming out of that respirator through that exhalation valve. So when we talk about respirators to protect the environment, it has to be one without a valve. And the same thing if you're in a surgical suite. If you're concerned about breathing in what might be aerosolized and not contaminating the sterile field, you can use a respirator instead of a surgical mask, but that respirator has to be a valveless or no valve respirator. And the other thing that this respirator can do is protect the wearer from the environment, meaning that, if it's properly fit, then when that person breathes in, the particles in the room will be filtered through that respirator. What is a respirator? A respirator is a device that essentially seals to the face. When you breathe in, the air goes through either, in this case, these filter cartridges, or it goes through the filter material. You'll hear the term N95. And what does that mean? There's a CDC-NIOSH standard for respirators. N95, the N means that it's not resistant to oil. You won't find oil in many healthcare settings, so that's not an issue. If you're in an industrial setting, you might need an oil-proof respirator. The 95 means that the filter is at least 95% efficient at removing 0.3 micrometer particles. And that's the most efficient. If it's smaller than that or greater than that, 0.3 micrometers, the filtration efficiency goes up. So when we talk about N95 respirators, an N95 respirator or higher is perfectly acceptable for coronavirus or TB situations. And if you're doing a high-risk procedure, something where you might be aerosolizing or be in super close proximity to an infectious person, then you might consider a higher level of protection. The other major standard in the world, though, there's some countries do have their own standards, but most of those standards are similar to either the US standard or the European standard. But the European standard tests filters to both oil and non-oil aerosols. They also require a test for total inward leakage, which means, how well does that respirator actually fit a person? It counts particles outside the respirator and inside the respirator. And I mentioned FFP2 earlier. What does that mean? FF means filtering facepiece. Like most N95s, it's a filter that seals on your face. So the FF is filtering facepiece. P2 tells you the particulate efficiency or the penetration of that filter. So for a non-oil aerosol, there's less than 6% penetration or greater than 94% efficiency. So it's very similar to an N95. However, it's also tested against oil aerosols. When we talk about total inward leakage for a European respirator, what it says is that the respirators are tested against a group of people, and there's less than 11% leakage. And that leakage could be through the filter, which you see here in the center. It could be the filter material itself, or it could be the seal or the interface between the respirator and the face itself. This is almost the exact same slide as before. FFP2 or higher respirator is perfectly acceptable for coronavirus and TB situations where you're in close contact. Question that I get quite often is a real versus a counterfeit. What's the difference between real and counterfeit? Real means it's a respirator that's been truly tested to some standard. Counterfeit is one that has not. And what you're probably thinking as a question is, well, should I wear a counterfeit or not? And I'll give you part of the answer now and part of the answer later. The part I'm going to give you now is it depends. And we'll talk about what it depends on. But let's take a look at this respirator. It says JFY, gives a model number, says NIOSH Respirator, N95, and a lot number. Is that a real respirator? Well, I'm not going to give you a total lesson on respirators, but it's not labeled correctly. So that's telling me that it's probably not a real respirator. Let's take a look at this photograph. This is actually from Eastern Europe. This is actually a husband and wife. He's a pulmonologist. She's a pulmonologist. And they're wearing an FFP2 respirator. And how do I know that? The labeling. Just because the labeling is correct doesn't necessarily mean it's real, but if it's incorrect, we know it's not real. So this one tells you the model, it tells you the standard, and it gives you the approval number. That's the same guy in the background, but here's a translator wearing an FFP2 respirator or an N95 respirator. And let's take a look at this one. It says it's kind of the same thing, NIOSH N95 particulate respirator. It gives a model number, but it doesn't give this the approval number. And the other thing you can see here is that stamp with the ink was done after the respirator was made, because you can see the fold and how the ink did. Now this is a real one, and I can tell it because it's probably a real one. I can tell it because the label is correct, because that TC is the approval number. And it was stamped while the filter material was flat before it got folded into this shape. If you want to find out what is approved or is not approved, you can go to this website. And in this particular one that I just showed you, it was a high-tech respirator. You can go through there and find, okay, high-tech gives you the approval number, and it gives you information on how to wear it and how to maintain it. All respirators also will give you user instructions. You know, how do you put it on? How do you wear it? And there are many other kinds of respirators that we won't talk about now, but they're supply air respirators, or like scuba tanks and other types of respirators. But if you're going to wear a respirator, we need to make sure that there's a training program. The medical evaluation is relatively simple for a standard N95 or FFP2 respirator. There's really not much. If you have severe asthma, you might have some issues breathing through that respirator with a little bit of resistance. Fit testing is to see whether or not that respirator actually fits you. You want to make sure you pick something that is real or as close to real as possible. Because we do know that even a quote unquote counterfeit respirator, maybe it's not 95% efficient, maybe it's 95% efficient filter. That's still much better than nothing. It's still much better than just a surgical or procedure mask. We want to make sure people understand when to use it, how to use it, maintenance and care. So here are a couple boxes again, just to show you that there are instructions of how to properly put it on. And also the flip side will be how to actually take it off. So here's a staff member and somebody doing an assessment with me. What do you notice in this photograph? The open door actually goes to not a coronavirus patient, but it's a drug-resistant TB patient. He's not wearing any kind of respiratory protection. She is wearing what? A surgical mask underneath her N95 respirator. So what is that doing to her seal, or the interface between the respirator and her face? It's actually making it so that it's not as efficient as possible. So what should she be doing? Well, let's take a look at this person. What is she? wearing? She's wearing a surgical or procedure mask. Is that something you would want to wear if you're in close proximity to an infectious coronavirus patient? Well, it would probably be better to wear a respirator. But if you take a look at what she's doing, she is wearing a respirator and she's using a surgical mask on top of it to help protect her from large droplets so that she can reuse that N95 or FFP2 respirator. And when we talk about respirators, this is a relatively small person. That respirator looks relatively huge on her. Without a fit test, you can't quantitate it, but you can probably guess it's not a real good fit. And this is, I call it a normal size respirator, regular size respirator. And I'm not endorsing 3M or any other company. But now take a look. I'm going to flip-flop back and forth. Look how big that one is. Look at that one. That's actually a small respirator. So in order to fit well, we want to make sure the respirator is sized to the person. So if you only have one size respirator, there will be a number of people that will not have an adequate fit with that one respirator. You might have to get a few brands or a few sizes. And what are these people wearing? They're sort of half wearing surgical masks. They're tied to the top, not at the bottom. Now, this is one of my favorite pictures. This is before we're going into a lab. And you can see, okay, some people are wearing it properly. One guy is protecting his neck. One guy is only breathing, mouth breathing through the respirator and has his nose out. So we want to make sure that, if you do wear any kind of respiratory protection, whether it be a mask or a respirator or something in between, that we wear it properly. When we talk about selection of respirators, it may be a filtering face piece respirator like the two on the left. You may find if you do a lot of continuous work, it may be more comfortable to wear one of these rubber or elastomeric respirators. Why? Because you can actually clean and disinfect that the rubber parts, the canisters that have the filters in them very easily, where you cannot do that with a filtering face piece respirator. Now, on the bottom right is called a powered air purifying respirator. You may have seen a few of these on the news, but they require a battery and a fan and a filter. It's just much more complex. How about this thing? Is this actually a respirator? Well, for one, it only has one strap. How well does it fit around this guy's nose? And what else happens? It sort of folds here. So this is not a respirator, and just common sense would tell you that it's not going to fit very well. And common sense should also tell you that this little thing on the left and the right is a flapper valve. And when you breathe in, it doesn't seal. And the only filter to remove particles is right here in the front. Now, where do you think this person stored this respirator? You can see it's all crumpled up and was probably in this drawer. And yes, that's where we found that respirator. I'm not going to go through all these user instructions, but for this particular model of respirator, it tells you respirators may be used until damaged, breathing becomes difficult, or contaminated with blood and body fluids. So that's the rationale that if you want to reuse a respirator, then we want to protect that respirator with something as simple as a surgical mask or a splash shield to keep it from getting droplets, large droplets on the surface. And just to let you know that I'm not telling you anything that we do not do here in the US, is the American Practitioners of Infection Control actually has an official policy on reuse of respirators. And you can read it when you have time, but it starts out talking about respirators for used exclusively for TB. And yes, you can easily reuse them until contaminated. But there's also a caveat for other respiratory pathogens that you can, but you have to take special precautions, and that's what we're talking about. How can you protect the respirator? Another question I get often is, can we disinfect respirators? There's vaporized hydrogen peroxide, germicidal ultraviolet light, and these other ones. But if we talk about the germicidal ultraviolet, what does it do? It actually destroys the surface or damages the surface of the filters, and it damages the straps. Dry heat's the same way. When you get too high in an autoclave, you get too high of a temperature, then you're damaging the elastic. Ethylene oxide and formaldehyde are toxic. Bleach, you don't want to breathe something that's been soaked in strong bleach. Soap and water and alcohol will destroy the filtering efficiency of the respirators. So we get back to vaporized hydrogen peroxide, and the issue with that is it's relatively expensive to do. So the best thing we can do really is protect the respirator, and then when in doubt, throw it out. So what can you do? We need to be proactive. We need to find well-designed respirators that will fit us. We know that we cannot decontaminate easily. We cannot clean a filtering facepiece respirator. We want to keep our respirators as clean as possible and store in a clean, dry place. Don't put them back in the plastic bag, because what happens when you put something warm and moist in a plastic bag? It's promoting the growth of bacteria. We don't know for sure what it does to the coronavirus, but for sure it's not very hygienic. And then closely monitor the hygiene and the service life. If the straps start to get loose, then you're not going to get a good fit. And this last bullet is really what I just said previously, is when in doubt, throw it out. So to summarize here is we need lots and lots of SOPs. How does one wear it? When does one wear it? And I say it because it may be a respirator, it may be a mask. For healthcare workers, we want them to use valveless, preferably certified respirators when in close proximity to patients, because they'll protect healthcare workers from microdroplets and protect others from you. And for the general public, we generally recommend the use of surgical or procedure masks, both to protect the wearer from large droplets and protect others from you or the person wearing it. The second summary slide is really a mission for all of us, and that's work hard, play hard. We want to promote good public health. We want to be safe, and we have to enjoy life. So there's one of the last pictures I have of my father and our dog when she was a puppy. But I also am a dog person, and I found this also on the internet, that this dog's ready to go outside. The dog has its mask, has its gloves, has its toilet paper, has its alcohol. So she's just ready to go. So anyway, on that note, I thank you much for your attention. And I believe Victoria is going to facilitate some questions, and I'm happy to answer any of the questions. I think that Victoria is going to give you some information on asking questions if it's not obvious. So back to you folks.
Thank you very much, Paul. That's really informative and really interesting. And yes, you're right. There are a few questions that we would like to ask. I just want to encourage everybody who is listening to write your questions into the chat box. We are monitoring that chat box and summarizing those questions. Paul, look, I've found that so interesting, and I'm just sort of thinking with all the questions that we've had to date, which ones should I start with? But I just wondered if you could perhaps maybe clarify the different types of masks. I noticed that you had a photograph of yourself wearing a cloth mask. I'm not sure if it was a homemade cloth mask or a purchased cloth mask. We've talked about the N95 respirators. There's also 3M masks. It looks like 3M makes an N95. Is that a brand name? I just wondered if you could maybe spend a few minutes discussing the different types of mask and whether there is, one is preferred over another. One type is preferred over another.
Certainly. And first off, what I want to try to do, and it's kind of confusing because the news media and everybody else calls everything a mask. What I try to do is use the term respirator and the term mask, and the mask could be surgical mask or procedure mask, and they're really two different entities. I may have used brand names, which 3M is a brand name, but when we're talking about needing to protect the wearer from small droplets, we want that wearer to use an N95 or an FFP2 respirator. So it's something that's certified to either the European standard, the US standard. New Zealand has their own respirator standard. China has their own respirator standard. A lot of countries do have their own respirator standard, but it's similar to one or the other. When we talk about surgical or procedure masks, there's a huge range there, from something that's a very thin fabric that if you hold it up to light, you can see through. There's some paper, there's some heavier fabric ones. The one that I wore, actually a classmate from high school sent these. She felt it was her mission. These were homemade cloth masks. They were relatively heavy material. They were double layered, and I had a relatively tight face seal. So when I had it on, if I breathed in, that mask collapsed a little bit. And when I breathed out, it expanded a little bit, which is the exact same thing you'll see with a respirator. So when we talk about masks, they come from anything from, you know, really loose fitting to not being very efficient to relatively tight fitting. And the tighter the fit, the fewer particles will escape if you're infectious and wearing one, and the fewer particles will get in if you're wearing it to protect yourself from what's in the environment. And I've seen some of the, and you'll see in the, I've got some extra slides after this one. Oh, I thought I had it here. I took them out of this presentation, but they're in your handout. But I've seen some where they take a high efficiency filter from a vacuum bag and actually place that in between the two layers of fabric to provide something that's in between a respirator and a mask. So based on the risk that you're exposed to, you would say, okay, I need, you know, a simple mask. I need a relatively efficient mask. I need something closer to a respirator, or I need a respirator. I hope that clarified it.
Yeah, thanks very much for that, Paul. I mean, I guess the you know, a mask is going to capture large droplets, be loose fitting. A respirator will be tight fitting and capture or stop those small droplets. So that's a really nice clarification. Another question that we have had come through is, how long should a mask be worn before it is replaced?
Okay, that's another I won't say difficult question, but the answer is it depends. So when we talk about a mask, we have to understand, you know, whether we're talking about a surgical mask or we're talking about a respirator. In either case, if for some reason you question the hygiene or cleanliness, then we need to change it out or see if there's a way to disinfect it. With a respirator, again, you can protect the surface of the respirator by wearing a surgical mask on top of that respirator. We've done studies that have shown that you can wear a respirator for a long, long period of time, and the filter will not decay, you know, as long as you don't dip in alcohol or do something to adversely affect the filter. But the weakest point of a respirator are the rubber bands or the straps. You're going to find that those rubber bands or straps are going to stretch. And as they stretch, that means the fit of the respirator against your face is get weaker and weaker. So when I'm looking for a respirator, if I want to reuse a respirator, I would look for something that has something other than the very thin rubber bands, because those thin rubber bands, you can stretch them and you'll find that, after maybe 5 or 10 stretches, you're not going to get a good fit on the respirator. Where if you have something that's more like underwear elastic, where it's a fabric coated elastic, that kind of a strap will last you a much longer period of time. And with surgical masks, a lot of those have elastic that goes around the ears, but the ones that probably give you the most length of time are ones that you can actually tie, because you can tighten those to whatever is comfortable to you. And the other advantage of a lot of these cloth masks, not respirators, but masks, is you can wear it for a day or two or a few more. And when you start to question the status of the hygiene on that respirator, on that mask, what do? Simply throw it in your wash with hot water and soap, and then after it's dry, you're ready to use it again. Thank you.
Yeah, thanks for that. That's interesting information about just being able to wash or machine wash cloth masks and then be able to reuse them again. Another question I've got is, how are the efficiencies of the respirators tested?
Say that one more time, please.
How do they test the efficiency of the respirators? You were discussing the efficiencies of the respirators.
Okay. Both European and US will take a respirator, they'll seal it or glue it to a piece of plexiglass. They'll put particles on one side, measure the particle concentration on one side, usually it's sodium chloride or salt particles, and then measure it on the other side. And the difference will tell you the efficiency of that filter material with very small particles. So an N95 means that it's 95% efficient. A FFP2 means it's 94% efficient. And that's just the filter material. The advantage of the European standard is they will take that respirator, they'll glue it to the plate to check the filter material, but they'll also have people wearing the respirator, not glued to their face, just wearing it normally. And they'll probe the respirator, so that what they'll do is they'll measure particles outside the respirator and particles inside the respirator. So what that measures total inward leakage. So you can have 5 or 6% come through the filter, and you can have 4 or 5% come through either the exhaust valve or around the face and still pass the test. So if you have a respirator, and I'll use an absurd example, that's a cardboard box, it's not going to fit very well to your face. So if you probe that respirator and you're measuring particles inside and outside, you're not going to be at the 89 or 90% total efficiency, or 10% or 11% total inward leakage.
And that's going to vary quite a bit from person to person, because everybody's face shape is different. So the bypass or the leakage around the edge of the mask is going to fluctuate depending on who it is that's wearing it.
Exactly. And that's why if you're a smaller person, you need a smaller respirator. If you're a bigger person, you need a bigger respirator. And there's one respirator, and again, I'm not endorsing any particular product. There's one respirator manufacturer that makes the cup size or cup shaped respirator in at least 2 different sizes. They also make one of these folding respirators, but that folding respirator is one size, and they advertise it as one size fits all. And I can tell you for sure that, I have never, ever seen one respirator that fits everybody. Now, the cup-shaped ones have the advantage of, if you get a small, medium, or large, of fitting faces a little bit better than some of the folding ones that are one size fits all. There's another manufacturer that makes one that's like an orange or pink color that looks like a duckbill. and that works okay on medium and large faces, but it's not going to fit well on small faces. And then I guess about 10 years ago, they came out with a small size, and that's much better, but it's not perfect for everybody. So when I talked earlier about, having fit testing as part of your program, during this emergency response to the pandemic, you may not be able to do fit testing, but you should think about, okay, as an organization, should we start to think about doing qualitative fit testing for all of our staff? It's a relatively easy process. I could probably spend an hour just talking about, in situ or testing respirators, a specific respirator with a specific person to see, okay, are they getting the minimum level of protection?
Yeah, sure. Okay. Another question. According to the CDC, we've learned that masks were not for healthy people, but for people who were affected, such as patients, and also I could add in there health workers who are caring for those patients. Is such a statement still true?
Well, I'm laughing because the official answer is yes. The practical answer is no, and I think it will be changing. Because we know what the benefits are of surgical masks, and we know what the drawbacks are of surgical masks. Part of the reason for the initial recommendation was there was a fear that if respirators were promoted too much, there would not be enough for the frontline workers, those that have, sort of continuous exposure as opposed to periodic exposure.
Okay, thank you. Another question regarding the homemade masks. Should we be putting some kind of filter fabric inside the mask to change it out, or is the simple fabric good enough? If a filter in the homemade masks is needed, what could or should be used as a filter?
Okay, and I would say no, the extra filter is probably not needed. And the one that I wear does not have a filter on the inside. It's basically just it's not as heavy as curtains, but it's a relatively heavy 2-layer cloth. They're, again, on the internet, you'll see people putting vacuum bags in as a filter, and the problem with that is the breathing resistance through a vacuum bag. I haven't tried it yet, but I suspect it would be much higher than a regular. So I think you're best off with just keeping it simple.
Okay, thank you. What is your professional opinion on how masks have aided in overall ability for a particular country to flatten the curve? So, for example, there are some articles that say that countries like South Korea have got through problems easier because of the use of masks versus countries such as Italy and the USA. What is your take on this?
Well, that's very interesting because there's a lot of stuff floating around the internet where it circles. One particular one where it shows the sort of the exponential growth curve of cases, and it circles 3 countries and say, oh, they always wear masks. Well, if you take a look, China is a country that wears masks almost exclusively. Thailand is, but if you take a look, they're in that other bunch. So I think it's, masks may be part of the solution, but it's not the only part. And I think that's what we need to understand is that, yes, I do think masks are part of the solution, that masks actually allow me to be, closer to somebody that might be infectious. And if they're coughing, whatever they're coughing isn't going to go directly into my breathing zone or into my upper respiratory tract. Why? Because that mask, and I'm talking surgical procedure mask, isn't going to filter out 100%, but it's going to filter out some. It's going to slow the velocity of those particles moving towards the wearer. So there is benefit to the mask, but again, it's not the panacea or the only solution.
Sure. Isn't that, say, you know, there's 5% that actually gets around the mask and bypasses the mask? Wouldn't that 5% still be enough to potentially, you know, contaminate somebody?
The short answer is yes, but if we take a look at the physics and the physiology, you know, first off is, you know, there's not strong documentation of the airborne route. We do know that we can infect cats and some animals with droplet nuclei. We don't quite understand the efficiency of that. We know, for example, from the standpoint of TB, you know, if you breathe in and breathe out these very small particles, a lot of those particles will come back out. We also don't know, you know, to what's really the infectious dose in the lower respiratory tract. We know that large droplets in the upper respiratory tract through the mucous membranes, you know, can infect the person, but the very small droplet nuclei or micro droplets that get deep in the lung, there's a lot of unknowns there. You got more macrophages that can help fight the infection, though most of us are naive to the coronavirus. So there's a lot of unknown there.
Does things like facial hair, beards, or you know, cause a poor fit in masks? Somebody's actually written in and said at their husband's work they have requested all men to shave for a better fit. Do you think that that's true?
Absolutely, positively true. There's lots of data showing that with a respirator, facial hair, even, you know, like a one-day stubble, will affect the efficiency of that respirator. Why? If you take a look at what does that facial hair do? You know, it's actually pushing that respirator away from the face. So even like a one-day stubble, you know, has these little micro fibers pushing against the fibers in the filter material, and you will get significant leakage. Now, significant means different things to different people. You know, you'll definitely fail a fit test. So after a day of not shaving, you may find, and we've done some fit testing of people, a lot of fit testing of people, what you might find is, okay, you know, so instead of, you know, greater than 95%, maybe it's 90% efficient. Now, when you actually have a beard or established facial hair, you know, you're probably going to have efficiencies similar to a quality surgical mask.
Sure, thanks. So another question about homemade cloth masks. We've actually got a lot of questions coming through on these homemade cloth masks. Would you recommend them for people who have contact with random people through work, like supermarket employees and things like that? And also, do you know whether there is a document or guidance to standardize those masks in terms of what they should have, and you know, how you would actually get a good quality, how you would determine whether a homemade cloth mask or a cloth mask is actually of good quality?
Okay, so for the first question is, you know, just because there's so many unknowns, luckily I'm in Florida in a county that has relatively few coronavirus cases, but I'm one that when I go out in public, other than riding a bicycle or something like that in the community, you know, I will wear that cloth mask, especially going to the grocery store or something else. Why? Because, you know, there's a chance of, you know, a person out there that might be infected. I've followed, you know, appropriate social distancing guidance, so I don't think I'm a carrier. But if for some reason I am, then I'm protecting others by wearing that. For people who are, you know, grocery store clerks, what a lot of places are doing is just putting up a simple plexiglass wall so that when the person's talking or whatever, those particles aren't going into the breathing zone of the worker. And back when I started infection control work in the late 80s, there were lots and lots of places that had this glass partition on the table and the healthcare worker behind it for that exact same reason. So we're actually going back in time to promote good infection control for droplet spread organisms. Now I forgot what the second part of the question was.
Just in terms of whether there's some sort of document or guidance. Yeah. Like for example, your mask that you're wearing, does it look different on the inside versus the outside? So in other words, what stops you accidentally putting on one way one day and then swapping it around the next time?
Perfect,
it on?
Perfect question. I'll ask my wife to go grab it. Nance, can you grab the mask? And this was version 1 of my classmate, and I asked her that exact same question. Because, you know, what do I want? I always want the inside in and the outside out. I keep this mask in the car. I don't normally bring it in the house, but she went to grab it to show you. And let me, let's see.
Do you know if there's a document or a guidance?
No.
No such thing.
And let's see, how do I show my camera now? Let me go to Zoom. Let's see, new share, screen. No, how do I share my video? So I'm a little bit new to this.
There should be a little button that says start video.
Oh, start video. Oh man, that's too simple. Okay, there I am. Okay, so here's that mask.
Have you pressed the start video on your presentation? I can't see you yet.
You can't see. I see me.
Victoria, I think it's just the view option that you have, because he's showing up.
Okay.
Do you see me? Okay. So anyway, so there's that mask, and what I did. Can you see that? I put my initials and an arrow on the inside. And this way I always know that the writing will be against my face and which side is up. And what I talked to Roberta about actually all we was text, but I said, you know, there should be some way of making it so that people wear it the same way every time. And one thing that we talked about was maybe using, you know, like fluorescent thread on the inside and normal thread on the outside so that people understand which way to wear it. And then also which way is up. The other thing, can you see this little piece of wire here?
Yes.
Okay. What was not in this original mask was some way to clip it around the nose. So I don't know if you remember the picture that I showed you, but it didn't quite fit up here. So what can you do? You can get like a little piece of wire, similar to what you have in a respirator, put it into the top of the mask. Let's see, let me turn around. Put it inside the fabric. And this way, you know, you can actually fit this mask a little bit tighter around your nose. And that's not in anything that I've seen yet online, but I do think it'd be good to have some kind of a standardized design. But again, there are lots of different designs. Oh, Nancy just said that Michael's, which is a store here in the U.S., actually has masks with a pipe cleaner.
Okay, so they're readily available in lots of places. So similarly with the regular surgical masks, does the interior or exterior color of the surgical mask indicate a particular direction or particular protection? So in other words, is one side more protective than the other?
For commercial ones, I would say no. For homemade ones, I would probably give the same answer, that there's not really a difference. But like we just talked about, you want to make sure that you keep the inside in, the outside out.
Yeah, sure. Another question I've got is, how should masks properly be disposed of? You had a photo in your presentation of them littering the ground and so on. What is the proper procedure for disposing of masks?
Yeah, I think basically just dispose of it as normal waste. There are a few countries that want to consider it medical waste or regulated waste, but for the most part, just dispose of it so it's not potentially contaminated. Let me start again. So that potentially contaminated material doesn't get picked up by a kid or somebody else. So just dispose of it in the trash.
Okay. In some places, there still seems to be a supply and demand issue with being able to purchase respirators, say the N95 respirators. And so people are actually asking, where is it possible to purchase? I know this is going to be different from country to country, but have you got any recommendations in terms of, I guess in the context of this webinar, most people listening here would not be health professionals. So like, I guess you could then consider us to be general public. Where could the general public purchase an N95 type respirator from?
That's a toughie, because, you know, as you mentioned, it varies from country to country. You may still be able to find some in industrial settings. There's a big thing here in the US about getting approval to use industrial respirators in healthcare facilities. Well, there's no regulation that designates a respirator for healthcare versus non-healthcare. N95, whether it's used in a foundry or welding, is no different than a respirator used in a healthcare facility, with one possible exception. There are a few respirators that are also tested to the BFE, which is bacterial filtration efficiency, or it's the same standard as surgical masks. So there are a few respirators that are classified both as respirators and surgical masks. So it'd be valveless respirators with an extra coating on the outside. So that's one that you might consider, you know, healthcare specific, but you could wear that exact same respirator in an industrial setting, because what is it? It's an N95 respirator.
Is it possible to sterilize an N95 type respirator? If you think that it's become contaminated, is it possible to sterilize them?
Yes, but you have to be very careful. You can't use standard decon or disinfection methods. The filter material is a polymer that has a charge on it. So what happens is it increases the efficiency of that filter material. So if you put alcohol on it, you're going to remove that charge. And then instead of being 95% efficient, it might be 60 or 50% efficient. So you can't use alcohol. If you use an autoclave, you're going to destroy the rubber bands or elastic because of that high heat. About the only way that we found, and it's not cheap, is to use vaporized hydrogen peroxide, or VH.
Okay, someone's actually asked about steaming them, but I guess that would fit into, you know, a category where you're damaging that, the rubber bands
straps,
as well.
Right.
The straps.
Because most of the straps are actually stapled or glued to the filter material, and at that interface, for sure, you know, even if you carefully try to just steam the fabric, you're gonna damage the straps.
So for countries where, you know, maybe some of our listeners are in countries where it's difficult to get or obtain an N95 respirator, would you recommend that even as a you know, just a general member of the public, that people are using masks when they go out, you know, either shopping or jogging or exercising, and that they may be able to, you know, you would still recommend that they would use a cloth type mask?
Okay, to start with the end, you know, cloth type mask would be perfect. You know, and we have to take a look at risk. You know, if I'm riding my bicycle on the back roads, there's no risk. There's no need to wear a mask. You know, I might have it in my back pocket in case, you know, I end up stopping and talking to people, but for riding the bike or exercising, no. Going to the grocery store, out in the public where I definitely run into other people, then yes.
Okay, I think that's, thank you so much, Paul, for that. I think that is pretty much all the questions that we've summarized questions and put them into groups so that we're not trying to double up and ask the same question over and over again. And I think we've covered off all of the questions. I just want to maybe pass the mic back to Josue, if you want to just to sum up, Josue, and to put some final points into the webinar, that would be great.
Thank you, Victoria. So I think, at least by the comments I have seen in the chat box and by my personal experience as well, it has been a quite useful presentation, and the question and answer session also was able to clarify many things that we wanted to know. So I hope it was something useful for all our listeners, and as we continue to plan and to unfold our response to this pandemic, we want to thank all for your attendance to this webinar, and to look forward to the next webinar. We will be planning one in the near future, and we especially want to thank Paul for giving us his time, his expertise, being willing to share with us what he knows. And we all know that, as I always say, with this pandemic, whatever is said right now is true as of today. So we don't know tomorrow, the day after tomorrow, there might be new recommendations, new findings, and new truths. So we have to keep ourselves updated as time passes by. Thank you again, Paul, for being willing to speak to us, and we look forward to continue with this series of webinars, and we look forward to continue our relationship with the CDC through Paul and maybe others. Thank you very much.
My pleasure, and thank you all. Good luck.